Now a KPIX5 original report. In the U.S., COVID cases are now more than 1,000% higher than June, and the numbers keep on climbing. KPIX5's Cid Medina sat down with two nurses to discuss the physical and emotional toll the pandemic has had on them after nearly 2 years on the front lines.
I don't remember a time when it was this bad, where as soon as a patient dies, the next patient comes in just as sick.
Catherine Kennedy, a registered nurse since the 80s, has worked through the H1N1 pandemic, Ebola outbreak, and the AIDS epidemic. But she and her colleagues have never seen this many people die in a 19-month period.
We're seeing more hospitalizations quicker than we did last year, and now we're seeing younger folks. And we're saying, if you're sick and there isn't a need for you to come to the ER, stay home. Stay home. And that's really sad that we have to be that way, but there's just not enough room right now.
It's going to get worse because we are now seeing sicker people.
Mawata Kamara works at San Leandro Hospital and is also a registered nurse. She says they're now back to discussing how to make room for the concerning spike in COVID patients.
We're now putting patients in the hallway like we were when we were at the peak of the last surge.
But a shift has taken place inside many hospitals since the vaccine became available.
We are seeing an increase in volatile behavior, whether it's the patient or the visitors.
At the beginning of the pandemic last year, healthcare workers were recognized, applauded, even labeled as heroes. Now, some nurses say they're seen as the enemy.
Very verbally abusive, combative patients, especially in the ER. Those nurses and doctors are getting quite a handful.
He said he was going to come back to the hospital with a gun.
Just several days ago, Mawata says a man became volatile toward them after being told he wouldn't be allowed to visit a COVID-positive patient per hospital protocol.
We had to go on lockdown until the next morning. That was it for me. I needed a mental health day after that.
But even more difficult, Catherine and Mawata say, are the patients who trust social media over science, their neighbor over a nurse.
I was taking care of a 30-year-old patient who has COVID, and his whole family has COVID. And he told me, I wish I would have gotten a vaccine. I didn't take it seriously. Prior to this pandemic, nurses were one of the most trusted professions. It breaks my heart that we've gotten to the point where there's so much distrust in healthcare.
Catherine, who is the president of the California Nurses Association and part of the National Nurses Organizing Committee, remembers a time she told another nurse it was okay to cry.
She said, I held his hand, and held his hand and said it was going to be okay. And then when he did pass, she just broke down and started crying. It's hard and it's exhausting.
The nurses say they feel like they're at the center of a storm, including dealing with challenging work conditions.
We have one nurse doing the jobs of 3 people. That's dangerous. That's dangerous. One person should not be doing the jobs of 3 people.
And I'll have more on what they say were mistakes hospitals made at the beginning of the pandemic that left them unprepared for what was to come, and how they believe it put their lives at risk. That's tomorrow at 11 on KPIX. In San Jose, Cid Medina, KPIX 5.